Welcome to this edition of Reid Beside You. And today we have our special guest, Jennifer Stachler, a registered dietitian with Reid Health, and Dugan Wetzel, the executive chef at Reid Health. Welcome.
Hello.
Thanks for having us.
And I know that both Jennifer and I will say Dugan, Chef Dugan, have been partnering for several years now to provide free, and we want to reiterate that, free service, free cooking classes to Reid Health, our employees as well as the community.
Yep.
Absolutely.
And before we get into the cooking shows, I'd like to let our community know, how did you get involved in deciding to become a registered dietitian, Jennifer?
When I decided to become a registered dietitian, I was actually at Ball State University. I was originally going into special education and elementary education. Decided about a year and a half in that wasn't for me, and I started looking at other options. When I was in high school, I had a medical condition where I actually had to meet with a registered dietitian about a low sodium diet. And as I kind of was making my transition to find something else I liked, I said, hey, there's a dietetic program at Ball State. Let me see if I like this. Started getting enrolled in some of the classes and fell in love. Nice. And the rest is history and kind of how I got here.
Okay. And how long have you been with Reid?
Going on 5 years. I was actually a Ball State intern before they actually hired me. So,
okay.
Yeah.
That's great.
Yeah.
And Chef Dugan?
Yes. Actually, I, like Jennifer, started out at Ball State. Graduated with a political science degree, thinking I wanted to go to law school. But right before I started law school, I started working in a neighboring community's prosecutor's office, and wasn't really the job for me. It was stressful, taxing, just not something I wanted to do every day. So I really kind of, my fiance at the time, wife now, we sat down and talked, and really decided that, you know, I cook a lot. I like to be creative and do that stuff. So maybe culinary was the right path for me. So instead of going to law school, I actually went to culinary school, and came back to the area from Indianapolis and helped with the No. 9 Grill in Cambridge City, and then I've been working at Reid here for almost 4 years now. So. And
as the community outreach person, I work a lot with both of these people.
Oh yeah.
And especially Chef Dugan. Mm-hmm. And a lot of times when we have the opportunity to have food at various events, as well as our Medical Monday.
Oh yeah.
Then those are always catered by your team.
Absolutely.
And believe me, that helps with our crowd.
We love doing it. Yeah.
Great. Actually, tell me about the cooking classes at Reid Health. I'm going to start with you, Jennifer, on the healthy cooking. Okay.
What we have is a program called Healthy Cooking with Jennifer and Dugan. It is actually our community program where anybody within the community can come to it. It happens on the first Wednesday of every single month from 5 to 6 p.m. in Lingle Hall, which is the lower level at Reid Health. During that program, we have topics each month, different ones, and we've been doing this program for almost four years. I started on right before Dugan was hired on, I believe. I started with these cooking classes, and he came on board with them when I left for maternity leave, and he's been on board ever since. Yeah. And we just do various topics. We have different topics. We develop the recipes for them or search for recipes online, blogs, American Diabetes Association website, the American Heart Association website, different websites like that, recipes. And we actually make the recipe in front of the participants. Mm-hmm. Okay. They get to try the recipe, and then they leave home with the recipe. But the nice thing about it, though, is we provide nutrition information and also culinary information. So they're getting two different kind of perspectives of cooking within that.
And the participants, do they have a chance to ask questions? Or?
Oh yeah, it's very low key. They come in, we interact with them, we talk. It's not like it's structured, but yet it's free where they can just talk up. And we have a great following that have many of them been coming ever since our first one. Mm-hmm. And they come back month to month, and they know us very well now, and it's just very laid back.
Okay. And And what do you, Dugan, how do you feel about those same cooking classes out to the community?
It's good, especially being in Lingle Hall. We can
Spread out.
put as many people in there as possible. We get a really good following in that one, but there's always room for more people to come, obviously. But yeah, it's like Jennifer said, it's very laid back. It's very casual. We'll joke around. We'll get off topic sometimes and talk. If somebody cooks something at home and they're curious about why this happened, I can talk to them about it. Or if they're looking to replace something, they ask Jennifer questions, and I think it's a really nice program because it helps. It just helps people, and that's really what we're here for. So.
Absolutely, and that's something that I have a lot of patients that will come through the program, or vice versa. I'll be talking with somebody and they're like, wow, I would really like to meet with a dietitian one-on-one to learn more about possibly low sodium or counting carbs or anything health related, and I give them information back to our office as well and see if we could get them in for more one-on-one, more in-depth. So it kind of can go different places and lead you to other things available throughout Reid as well.
On that same note, so you were saying with your patients, and I know we have people that come in through the endocrinologist, through the diabetes center, as well as if a patient came in from the inpatient side, then they're referred to a dietitian as well.
I mean, we've been trying to get these cooking classes out to, just not, like I said, community, but patients, individuals inpatient. All of our information about the topics are actually found on Reid's website, so they can go and look at, the topics available. It's also for any Reid employees, all the recipes are found on the SharePoint site, so you can go find those as well for all of our cooking classes. So if you don't make it to one of those cooking classes, we can still get you the recipe and information for those.
Okay.
And I know that with the new wellness throughout the throughout Reid that's there, the Reid Healthier,
Yes.
individuals can get points for coming to our class, and because I hand in those rosters every week, so they could see who made it to those classes to get those points.
And we had, last month we had Tawan Stoker, and he spoke on Reid Healthier, so this
That's
just
perfect, yeah.
is a great segue
Absolutely.
on some of the things that people can do.
Definitely.
So, Jennifer, give me an example of your favorite topic from the healthy cooking classes,
Okay.
and possibly a recipe that
All right.
you enjoyed.
Well, I have lots of favorite topics over the years. One thing that I'm really interested in right now is I have 2 children of my own. My daughter's about ready to turn 3. My son's about ready to turn 1. So I'm in that phase of trying to make sure that they're getting healthy options. And one of the big things is getting those vegetables in. And I see kids throughout work time as well, one-on-one as patients. And that's one thing I see lack is those vegetables. So we are doing some cooking classes that are kid-friendly meals, kid-friendly vegetables, trying to incorporate more of those in there. And a couple of the recipes that we've done is we actually made veggie nuggets. We just actually did this with our employee cooking class that we'll talk about here in a little bit, that we use broccoli and carrots in these veggie nuggets, and I've actually made them with a little bit of chicken as well and compared them, and I couldn't tell which one had chicken and which one had vegetables in it. And that's something my kids love them. A lot of our moms and dads and employees who came to the program loved them as well. So that's kind of my area that I love right now, and that I'm incorporating back into the community, back into our employee cooking classes. We've even done what's called cauli tots instead of, potato, which is like tater tots made out of cauliflower. Okay. And you can also make them out of broccoli or also zucchini. So a lot of different options to get those vegetables incorporated in there, making sure that we get those 3 servings a day.
A question: when you were saying with the children, have we ever looked into having do people ever bring their kids
Absolutely.
to the cooking class?
Absolutely. We had actually, in our last community one, we did a healthy mac and cheese. Okay. So instead of using a cheese sauce, we used a butternut squash, and we also did one with cauliflower instead of using pasta. And that's something that we did have a kiddo who came to the class with his mom and I believe his grandma, and he liked them. He actually came up for seconds, and so we do get the kids involved. With some of our other programs, we involved some of our STOP kiddos, which is a program that we do throughout the Diabetes and Nutrition Education Department, which is Stop Taking on Pounds. It's a pediatric weight maintenance program, so we get them involved as well. A couple years back, we did one with kids where they came and they made those graham-wiches.
Yeah,
with
the
like,
apple wraps.
Yep.
And yeah, absolutely.
Yep. So we got them in kind of doing a cooking with us and got them involved in
Getting
making
them on the
it.
correct path, that as they're younger, then they'll grow to
Absolutely.
Certainly.
enjoy their vegetables.
Absolutely.
And Chef Dugan, what was your favorite recipe from the healthy cooking?
Well, this one was actually from our Cook Well in 30 program, which is what we have for our employees and their spouses. We do it once a month, and it's just basically it's Cook Well in 30. A lot of people are busy. You know, we're constantly moving. We've got sporting events we have to go to, plus work, and we just don't have time. So we stop and get fast food somewhere on the way or on the way back. What this program is for is to show people that they can still eat and cook healthy in 30 minutes time. So what we do is just get everybody in there. We have the food prepared for them before the class begins. So they'll go through and they'll get their food and they'll sit down, and then a half hour, start to finish, we make the recipe that they're eating, just to show them how easy and how fast it is, and how capable you really are of being able to do that at home. I'd say my favorite recipe that we've done so far was something we did back in January. It was a zucchini. Was it zucchini and squash?
Yep.
Yeah. We replaced that. It was like a lasagna skillet. So we replaced the pasta with the vegetables. So again, introducing more vegetables, getting people to try different things, and it was really good. We used ricotta cheese instead of the heavy mozzarellas with all the fat. It was awesome. I remember tasting it and thinking, wow, that's really easy and really, really good. I know I've got a 2-year-old at home too that's kind of opinionated as far as food goes, so it's definitely something that he would really like to eat. So.
Oh, great. And I just wanted to reiterate, that's the second, or it's actually 3 different cooking classes.
Yes.
We do,
And
yeah.
so the second one is the Cook Well,
Right.
and that's more of an internal Reid effort
Yes.
with our employees.
Yeah.
And the other, tell me about iHeart Cooking.
iHeart Cooking is a program that we actually partner with WCTV and also RPNL. We use their kitchen at RPNL where we go and tape actually programs that are aired here on WCTV and also are available on YouTube. So anybody out in the community who can't make it to our healthy cooking classes or, are homebound, don't have a lot of opportunity to get out, that we actually can, come to your house through the, TV and
TV and
internet to provide cooking programs. And it began by, we received a grant for our first season from the American Heart Association to do these cooking shows, or the iHeart Cooking program. And we used a lot of their recipes within their cookbook. After that year, our community benefits at Reid decided to pick up the program. And so we did that last year as well, and we're getting ready to start our 3rd season of iHeart Cooking. And again, it's just like our other cooking programs. We're looking at different recipes, making them, not only heart healthy because it's called iHeart Cooking, but when we develop them, we're looking at low fat, we're looking at lower calorie, replacing, substituting things, carbohydrate friendly for our diabetics, you name it, anything, nutrition related we look at. And then a lot of those culinary techniques that, Dugan provides for that, but just another opportunity for individuals within the community to see that program.
Now, do you still have an audience, or?
We used to have a live audience.
We did, yeah.
We actually do not at this time because it's hard because we shoot.
Right.
we tape that during the day, so it's hard for a lot of individuals to get there. So we do not do that. One new thing we're trying this year is we're hoping to get guests to come on the program with us to cook with us.
Yeah.
and there might be a possibility we will get Mayor Snow involved in cooking with
Great.
us.
And so for our viewers that are looking, make sure that you will have the contact information for both Chef Dugan and Jennifer.
Yes.
And you might need to be a guest. We might be able to grab you a quick audience. So.
Absolutely.
And that's something, if you ever want information about any of these programs, a lot of them are available on Reid's website. If you want additional information, you can always look for Diabetes and Nutrition Education Department. Call them about, signing up for classes. The phone number is 765-983-3423. That's the department I work at, and that's where we can sign you up for those classes, give you information. We have handouts with all of the information provided that has, like this year, this handout shows Healthy Cooking with Jennifer Dugan, has every single topic that we're covering this year. It has the time, the date, the place, and also the location for where that's found at.
And as I'm looking at some of the upcoming titles, I believe the next one will be April 5th.
Yes.
What's the buzz?
What's the buzz around barley?
Okay.
So we're kind of doing some different things with barley there. Some of the recipes are from the American Heart Association website. Some of them I find through blogs. We're also doing gluten-free, and that's another common one for anybody with celiacs or watching gluten-free diets. Another one I'm very excited about is called Low Carb Recipes for Favorite High Carb Foods. I work with a lot of diabetics, so that's something that they're recipes that we kind of replace the pasta, or giving you different ideas on how to drive down those carbohydrates in that dish.
I remember you came to a downtown business group with the chamber.
Yes.
And showed us quick meals on the go.
Yeah, for breakfast.
For breakfast.
Yeah.
And it was really amazing how so many people really followed you. And I still get calls and people say, I still use the technique with the eggs.
Oh yeah, the
So,
omelets. We
the
made omelet in a bag. Yeah,
And
something
so
to
that's always
using on the go.
successful. So as much as we're here to talk about the cooking show, I didn't want to forget that comment, as well as just an overall view from a Reid Health standpoint. We get Dugan is very creative in the cafeteria on some of the things that we offer. So, one of the things like the sweet potatoes instead of just potatoes and baking things. So that just puts in the presence of mind to everyone to look to see what are so many of the other options.
Absolutely, yeah.
Yeah, absolutely.
We're doing a Choose Well program in our cafeteria in the hospital. It's kind of an initiative for employees, but not just employees, but people that are there visiting, just to have healthier options for people to choose from. Because we're looking at our sales and seeing that our highest numbers are fried chicken and just things that are deep fried. And we're a hospital. We're trying to put our best foot forward here with some new options, some healthier options for people to try. A lot of comments, a lot of positive comments. Some are not so. I'm not saying bad, but they're kind of iffy. Yeah.
I want to interject on the Choose Well. Give us the example of the Choose Well grilled cheese versus just a regular grilled cheese.
Well, regular grilled cheese, you can put it on Texas toast. You can put it on white bread. You can do it all these different ways. Where thicker breads, you're going to have more carbs and things like that. Whereas the Choose Well, it's a whole grain bread, and you have a low sodium cheese. So it's just making other choices to subtly change your diet. It's still going to taste the same, very similar. You're just making subtle changes and improving your overall health. So.
I know as an employee going into the cafeteria, there's been times that it's amazing, subconsciously you don't realize, but when you look at some of the Choose Well items versus some other items, and you're thinking, I want that sub sandwich right there, and then it has 800 calories, and your other options are 300. well, I guess I don't want that sub sandwich. So I think
See,
just by putting that in the
Oh, yeah.
public's,
That's what's great about it is we just put in menu boards last year, and before that you could get on our website and you could see what we were serving that day, but to have it right there in front of you and
Correct.
say that this, let's just say Hoosier hoagie is 900 calories, you're gonna second think it.
That's it.
Be like, oh my goodness, yeah, that's maybe a little too much. And then
correct.
you
No
get the-
matter how good it looked,
Yeah.
I said, no, just not.
Yeah, I mean, I do the same thing, so I
So I've had to
completely understand.
turn around and say, okay, I'll take the choose well.
Yeah,
So,
yeah.
but it's helped. It's definitely helped.
Mm-hmm.
The iHeart Cooking, just wanted to reiterate that it's on Mondays at
Yes.
9:30.
Yes, WCTV Monday at 9:30, and then it airs periodically throughout the day on Tuesdays.
Right, from that highly popular 2:30
I
a.m.,
know.
7:30, 11:30, and 4:30 p.m. like the following day. So,
Okay.
and I'm not sure. Do you often get people that walk up to you that say,
Yes.
"I saw you"?
Surprisingly,
You can't
yeah.
go shopping anymore because
No,
people
not
come up
really,
and
yeah.
Oh,
then they ask
yeah.
you
I don't like to go
questions.
shopping because then I'll get people follow me around like, what's Jennifer putting in her cart? But it doesn't bother me too much for that. But yeah, we do get individuals that come up, and you say you get that a lot in the community.
Yeah, really. A lot of like we'll go out to businesses and do cooking demos and things like that for them, and I'll have people come up to the booth and say, aren't you on TV? I was like, yeah, we're on WCTV. We do a cooking show there. So
Can you help me with my shopping menu here?
Oh, I get that a lot.
Yeah.
Yeah.
yeah, absolutely.
And
So now we know that you need to stay an extra an hour at the grocery store,
Yeah, it takes a little longer.
or
Yeah.
you'll go a lot different. The what are an example, possibly if we can work with? I know that we're hoping with a partnership with the mayor later on in the year. Do you have any other dream guest per se?
well, there's been a lot of names kicked around, kind of who to invite. It kind of depends again on schedules. We don't have any really thing set in stone as for now, but that's something that's, I mean, if anybody wants to come be a guest, that's something, maybe give us a call and see what we can do. But we're always looking for somebody to get involved with us.
Yeah, it's really tough, especially with
With our schedule.
You
Correct.
have patients.
Yeah.
We have catering, and we serve a lot of food to a lot of people, and then they have jobs. So it's just trying to find a time that everybody's free at the
So
same time.
it's
Yeah,
trying to get on this show is just as we're trying to do healthy cooking and
Right.
30-minute cooking,
right.
Yep.
and trying to put it all together, and then make sure it's an enjoyable project.
Yes.
So just wanted to just recap and go over again that we have 3 different methods to reach out to the community. So we have the healthy cooking,
Yes.
and we will definitely have a slide that the viewers can see
Okay.
about the schedule, as
Yes.
well as, is the schedule on the Reid website?
On the
Actually,
Reid Healthier website. Is
I
that right?
believe it might be
It
on the
might
Reid
be.
Healthier website.
I'm so used
Yeah.
to
If
my
not, we'll make
handouts.
sure. We'll make sure it gets on there.
We'll get that out and available for everybody to have.
And I highly recommend that because we really like to have those samples, and you really learn a lot.
Oh yeah.
As
Absolutely.
well as then for our internal employees,
Yes.
we have the lunchtime
The Cook
employee
Well 30.
cooking class,
Yep.
and we do get points for that.
You do.
Absolutely.
Absolutely.
So we
Yep.
can put that in our manage well.
Yep, the wellness
Yes.
coaches come to the class as well to see who all came.
I'd better go to that. So
Come on
make
down.
sure
It's
that I
quick
come to
and it's
that next
fast.
one.
Yeah.
And then finally the iHeart
Higher
cooking,
cooking.
cooking.
Yep.
which seems to be the most longevity that we've had. So that's our grandfather of our cooking classes.
Certainly. Yeah.
And getting that in, and we would love to have our community to follow us, and they're great people.
We like to have fun, so come
Yeah.
on down to any of our cooking
And
classes.
someone from the community also, if they happen to have ideas, can they contact you?
Absolutely.
Yeah.
We're always looking for ideas. So at the end of every year when we're looking at next year's schedule, we often
ask
hand out
people.
surveys. We ask them, what are you interested in? Because we want to know what you guys are all wanting to learn. I mean, we have ideas, but they might not be what you guys are what everybody else is interested
Right.
in.
Sure.
And that's where we want to draw the interest and ideas and cooking techniques. I mean,
Yeah.
I think we have roasting coming at the end of this year, how to roast vegetables, and I mean, not just healthy ideas, possibly. I mean, we gear it towards health. We can always make
Right.
changes for those. But even cooking techniques, we get a lot of questions. How can we do this? And then I'll find a healthy recipe that gears towards that cooking technique.
But that's like the one key, always making a healthier choice.
Yes.
Right. Absolutely.
Absolutely.
And that's our first thing, especially as I'm talking to our dietitian.
Yeah.
Yep. I'm always going to find a way to tweak something or make it healthier one way or another.
So that's always exciting. And was there something else you'd like to add?
Well, just thank you for having us on the
Yeah.
program as well. We love getting these cooking classes out. We hope to continue them as time goes on,
Right.
and I think we will. I mean, we definitely have a large crowd that comes each month, and hopefully we see some new faces in the crowd.
Well,
Absolutely.
great. And we want to conclude by saying that we, at Reid Health, Reid Beside You, offers 3 different cooking classes. That would be the healthy cooking class, the cook well for the Reid employees during lunchtime, and I Heart Cooking.
Yes.
So thank you very much, Chef Dugan
Thank
and
you.
Jennifer.
Thank you.
Yeah.
And we'll tune into your show.
Monday evenings,
Monday.
iHeart Cooking, 9:30, or we'll see you the first Wednesday of every single month for Healthy Cooking with Jennifer Dugan. And the employees, maybe we'll see you at some of the Cook Well at 30s at 11:30 on the 3rd Monday of the month.
Yes. Yeah.
To include
Great.
that.
And thanks for joining Reid Beside You.